Hello again. We have here a wonderful model of a spine. We will call this Tom. And what I'm going to do is kind of explain to you how your nervous system works and what a chiropractor does in turn to help fix any problems you might be having with your back. So if you can envision here, this is a segment of your back. Your head would probably be way up here somewhere, okay? Now in your skull sits your brain. Now for most of us, our spinal cord connects to our brain and it runs all the way down our back. Now, the thing that protects your spinal cord are these bones, and these are called vertebrae. And these inside of your vertebra sits your spinal canal. And these vertebrae are individual joints, just like your elbow is a joint. Now, if you came into our clinic and your elbow was stuck in a position like this, you'd be concerned, and we obviously would be concerned as well. The thing is that these vertebrae, they can move as well, and they move just like any joint would. And on occasion, they can get out of place, especially if you're in something like a motor vehicle accident, a fall, if you do a lot of computer work, things of that nature, a bone can get kind of out of place. Now when it's out of place, it can put pressure on these yellow things, and these yellow things are nerves. Now do you think when you have pressure on a nerve that feels good, or if that nerve's being pinched that feels good? Not at all. So what a chiropractor does is he finds the spots in your back and your neck that are out of place, and he adjusts them. Now when he adjusts them, it takes pressure off of that nerve and it helps you feel better. Other things that can happen are when you have things like these problems with these red items here, and these are called discs. Now these discs typically act as shock absorbers, so that when we walk, we're not absorbing obviously as much shock and putting as much force into our spine. But on occasion, these discs can herniate, and so to speak, they can kind of bulge out to one side. Now when they bulge out to one side, that can increase the amount of pressure again on these nerves, and that can cause even further pain. Now if you can envision this, you have nerves that come out of your neck and run down through your shoulder all the way into your fingers. Likewise, you have nerves in your low back, kind of near your belt line, that come down through there, pass through your glutes, down past your leg, and into your foot. Now if you have pressure on a nerve, for example, through inflammation, through a bulging disc, through a bone out of place, it can put enough pressure on that nerve that you can actually feel pain all the way down into your fingers if you don't get it taken care of. Likewise, if you have a similar situation where you have inflammation, a disc herniation, or a bone out of place, you can get enough pressure on one of those nerves that you can feel pain all the way down into your foot. So oftentimes we'll see patients that have pain or just numbness and tingling in their hands or numbness and tingling in their feet, and they don't always put it together that it's related to their back and neck. So again, what a chiropractor does is he finds those spots, he adjusts them or uses various techniques to correct those spots, and over time gets those joints moving again, taking pressure off those nerves. Now a lot of people want to know, why do I have to keep coming back to a chiropractor? Well, if you put braces on your teeth for one day, do you think your teeth are going to get straight? Or if you went to the gym one time for that New Year's resolution and then never went back, do you think you're going to look like Arnold Schwarzenegger? Of course not. So it's a similar idea when we adjust you. If you have a bone out of place, it's probably been like that for a while or was created as a result of a traumatic incident like a motor vehicle crash. So in order to train your body to get that bone to function the way it's supposed to, we need to adjust you the treatment plan with a number of adjustments over a period of time. And that is basically what we're looking at when a chiropractor is assessing you. Each time you come in, we assess your vertebral alignment, see how things are moving, see how your muscles feel. We do a complete assessment so that we can get you back onto the road of health and feeling better in the quickest and most efficient way possible.